Hello, everyone. My name is Brian Bursic, and I'm a medical student at the University of Toronto. My project is titled Natural Language Processing for Stroke Diagnostic Imaging Characterization. Despite significant advancements in therapeutics, stroke remains a leading cause of death and disability globally. When a patient comes into the emergency department with symptoms of stroke, the key diagnostic modalities are CTs, CT angiograms, and CT perfusion scans. These neuroimaging reports contain important narrative data on clinically relevant stroke attributes, but harnessing this data on a macro level is limited. Our study aims to apply natural language processing to identify pre-specified stroke attributes in unstructured neuroimaging reports of patients diagnosed with stroke. In leveraging this health data, we hope to 1. Improve disease surveillance, 2. Aid in future clinical decision-making, and 3. Further clinical research. Here we wanted to show a made-up example of a CT and CTA report. The image on the left is the CT angiogram, where you can see the vessels of the brain looking for an occlusion that is causing stroke-like symptoms. The image on the right is a regular CT of the brain, where the radiologist can look for signs within the brain tissue that indicate there is a lack of blood flow. The words on the left are what the radiologist would report. These reports are what we are interested in and what we have used to build our model. In terms of our methods, thus far we have labeled about 1,300 diagnostic imaging reports. Our primary outcome of interest is the presence of a proximal large vessel occlusion in the middle or anterior cerebral arteries. Secondary outcomes include identification of a clinical scoring number, the presence of a distal occlusion, hemorrhage, and signs of oxygen deprivation. We then developed our model by training the clinical BERT deep neural network and compared it to the bag of worms and TF-IDF standard approaches. Our deep neural network with clinical BERT currently achieves similar accuracy to standard approaches for most studied outcomes. So far, our study and preliminary results demonstrate a robust NLP model for characterizing relevant clinical variables in the monitoring and treatment of acute ischemic stroke from radiology reports. Beyond fine-tuning hyperparameters to achieve accuracy acceptable for the clinical setting, next steps include integrating the individual predicted results into a model that simultaneously predicts all outcomes within a single CTA report. We will also validate the generalizability of our model on a held-out dataset from a separate regional stroke center. Here are a few citations. A big shout out to the wonderful team behind this project, our funding agencies and institutions. Thank you for listening to a brief overview of my project. I would love for you to stop by my poster, especially if you have any suggestions or tips for our team's directions. Looking forward to it.